9 billion menstrual by 2035. So that's a large number of consumers who are accessing menstrual products from commercial markets and who will be, and for whom the safety and quality of these products is extremely important. LMICs offer high growth potential for these markets as well. This is a huge market, almost $20 billion USD in 2022 and poised to grow to about 33 billion by 2035, almost like a cumulative average annual growth rate of 6 to 7%. And while the sort of mature markets like Europe and US contribute largely to the size of this market currently, the growth is going to be coming from the low and middle income countries, which are experiencing exponential growth rates across the board. We also have seen increasing number of product options available in LMICs, from reusable products, but within single-use products, also sustainable options, more environmentally friendly options, and a variety of different materials used for both reusables and single-use products. In LMICs, we also see an increasingly complex market with a lot of small, medium, and large players, innovations coming into the fray, an increasing number of manufacturers, marketers, and growing volumes of trade. So if you just go to the World Customs Organization trade data under HS code 96119 and see some of the export-import data for some of the low and middle income countries, it will show you that this is one of the growing sectors, even as far as international trade is concerned. So that's why LMICs. And why harmonized standards? By harmonized standards, we mean standards that are same across different regions. So as the ISO website says, standards are a formula that describes the best way of doing something, and it is the distilled wisdom of people with expertise in their subject matter. We hope to have standards that provide just that, a formula that describes the best way of making menstrual products safe, that are good quality and safe for consumers everywhere, and that benchmark of safety is the same and based on the expertise of global experts, the best experts available from all over the world. These should ideally ensure objective and a minimum common benchmark for consumer safety everywhere. And harmonized standards also allow reduced barriers to trade. So someone who's producing in a country can easily then sell their products in another country, which at the end of the day allows for increased access to safe products for as many consumers as possible across the world. When we talk about harmonization, usually the starting point of talking about standardization is national standards bodies. If I'm in India, I will engage with my country NSB, which is the Bureau of Indian Standards, and their National Mirror Committee, which is the committee which will be looking at standards for menstrual products. And I'm just sharing this for context for those of you who are not familiar with language around standardization. And in each country, the National Mirror Committee for each NSB will be looking at menstrual product standards of their own. And then there are efforts at regional levels where regional standards bodies like the African Standards Organization or the East African Community have also created standards for the region. Now, there are organizations and many efforts that have advocated for standardization at the national level, but then over a period of time, the community has realized, the advocacy community, that it's easier to have and advocate with standards with one global body, which is the International Organization of Standardization, which is why the movement started, and the Swedish Institute of Standards actually initiated this process of setting up ISO TC 338 with a proposal for the same, and holds the secretariat along with the Ghana Standards Authority today. So why harmonized standards? Because we want harmonized standards across different countries, but it's easier to advocate at a global level with global experts in one place rather than in every country separately. So collective action. LMIC engagement is essential towards ISO TC 338 because it is critical to ensure that these standards are relevant to low and middle income country contexts, to the technology and resources available. They are easy to adopt within existing regulations and policy frameworks. They're sensitive to the context, socio-cultural, economic, political, and across low and middle income countries, the lessons learned are often common. The challenges, opportunities are also often common. So ISO TC 338 is making special efforts to support LMICs to participate in the TC. And more information can be received on this from Ulrike from the Swedish Institute of Standards, and I'll request Arundhati to add her email within that. These provisions essentially build on ISO provisions for sponsorships for delegates through their national standards bodies and twinned arrangements for national standards bodies. But there's also supported through additional funding from donors like the Sanitation Hygiene Fund, Gates Foundation, and the Case for Her, which have allowed for extension of these provisions for support to low and middle income countries. And we'll hear more about this from our excellent panel today. So without further ado, I will go into our first panel for the day. But before that, we'll do a quick, check of the room, and I'll request my colleague to launch a Zoom poll. And I request all of you to provide your responses to that, so that we can just get a sense of where we all are before we start this discussion today. So the first question talks about, why do menstrual product quality standards matter? What does that mean for you? Which stakeholders should be involved in setting menstrual product standards as per you? Who's good to have, who's essential to have, and who's not really relevant? And are you aware of your country's engagement with ISO TC 338? Then I think it'll be good for our speakers also to see some of this data as we get into this session.
Just a tip, just scroll down on the bar on your right where you see the poll to access all three questions.
Thanks, Arundhati. Okay. Answers are coming in. So while we do get some more responses on that, let me introduce our excellent first panel of the day, and I'll request all four of our speakers to come on camera and unmute themselves. So we have Francisca Frimpong with us. Francisca is the Chief Scientific Officer at the Ghana Standards Authority. She has over 15 years of experience in standardization and conformity assessment, and she co-manages the ISO TC 338 as part of the Twin Secretariat from Ghana Standards. The second speaker we have with us today is Fayazuddin Ahmed from WaterAid Bangladesh. Fayazuddin is a lawyer and policy expert with extensive experience in rights, governance, and gender. A Shemiding scholar with an LLM from Warwick, he now leads policy and advocacy at WaterAid Bangladesh. And Bangladesh is not yet part of ISO TC 338, so we're really looking to learn from Fayaz how he can help us, and other advocates in the country can help us in that effort. Our third speaker today is Cynthia Paes from Kimberly-Clark, Brazil. Cynthia is the product safety leader at Kimberly-Clark, Brazil, with over a decade of experience as a safety assessor for cosmetics, medical devices, and hygiene products. And she's worked in clinical research and cosmetovigilance, contributing to safer and better quality products for all consumers. And last, but definitely not the least, we have Kelvin Kinua from Kenya. And Kelvin is a regulatory and quality compliance specialist and a technical expert member of the National Mirror Committee at Kenya Bureau of Standards. So KEBS TC 69, which is the country level committee. As an active member of KEBS TC 69 and ISO TC 338, he's contributing to national and global standards for menstrual products. So welcome to all of our speakers today. And as I welcome you, I'll also quickly share the poll results to get us started. And as we can see, first response, which is, why do menstrual product quality standards matter? I think all of these are important for people, but what clearly stands out is protecting consumer safety. So whether we are looking at it from the point of view of of a manufacturer, of a regulator, of an advocacy organization, I think protecting consumer safety might be the most important, closely followed by setting minimum benchmarks for product safety and performance. In terms of stakeholders that are considered important, I think we are pretty much aligned that everyone is needed. So everyone is, I mean, we have good responses for all of the stakeholders, but in terms of necessary, definitely large manufacturers, small and medium manufacturers, national standard bodies, and also ministries of health, education, and WASH. But we'll also learn from our speakers about why some of these other stakeholders are also relevant to the conversation. And interestingly, almost half are aware of their country's engagement with ISO TC 338 and half are not. So we have an interesting spread of, participants here. Okay, so to dive into the discussion today, and I'll just quickly, yeah, speakers are spotlighted. Great. So I'll ask all of you to provide a little bit or a quick introductory remark on, why do you think that menstrual product standards matter for your country and for your organizations if relevant? And also given that wherever you are or wherever your country is in the standards journey, how does being part of ISO TC 338 help with the agenda, help with the country's efforts towards establishing these standards? And maybe we can start, Francisca, with you, since you're already taking a leadership role with the Twin Secretariat. So we'd love to hear from you.
Okay, thank you very much. I hope I'm audible. So for us here in Ghana, standards are really important to us. And this is because as part of the work of the Ghana Standards Authority, we are supposed to protect our consumers. How then do we protect our consumers if we do not have standards in place to guide manufacturers, to guide regulators, to regulate and sanitize the industry, and also to give confidence to consumers? And so standards are very, very important. And that is why for us here in Ghana, what happened was that the drive for the standard was from the stakeholders. So stakeholders identified the need for the standards and drew the attention of Ghana Standards Authority, and then we took it up. And so we have the backing of the stakeholders within the sector, and based on that, we nationally developed some standards within the country ahead of the ISO 338 standards that are being developed. This is because it takes quite a while for standards to be developed on the international front. And because we have products on our market and looking at the issues that were raised by stakeholders and the need to have the standards in place, we actually had to put together some national standards to start implementing, and then ensure that we actively participate in ISO 338 to get our comment and our national position considered at that level. And what it means, or what is going to help Ghana, is that since we are having our national position being considered, once the standards are published, the uptake of the standard by the regulators is going to be very easy because they were part of the process from the onset. They had their inputs considered. The requirements were explained to them, and they were very much aware about it. So it doesn't spring up on them as a surprise. And so participating in the ISO 338 is very important for both the national standards body as well as the regulators, and then the other stakeholders, including the manufacturers, who are all on board from the onset.
Thanks, Francisca. That's very helpful to know. One, that it's stakeholder driven, and that you're well set up for buy-in for adoption once the standards actually created through this participation. Kelvin, would you like to respond to this question? Where's Kenya in this journey? Why does this matter? And how does being part of ISO TC 338 help?
I hope I am audible to everyone. A beautiful rising to everyone joining us from around the world. It's really wonderful for me, first, I must say, to connect across different time zones for a conversation that really matters for more than 1.7 billion menstruating people across the world. When it comes to Kenyan perspective and why it matters to us in this part of Africa, I would like to summarize it in maybe some few words. That what we are calling the standard are silent protectors of trust and confidence, whether one comes from a low and medium income country or comes from a developed country. From where you come from, it really doesn't matter, but this is a kind of a silent protector, and trust is in that standard that whatever is manufactured, that remember is the only basis that the consumer on the other end can trust that the product I am using for sure safety is guaranteed. Thank you.
Thanks, Kelvin. And do you want to share why or how has it helped KEBS or the Kenya Bureau of Standards to be part of ISO TC 338 in this effort?
Oh, sure. I think I can just go ahead and allow me first to say that it was on past Tuesday, on September the year 2020, I had visited a girls' high school in a small county here in Kenya called Ghana. And while I was having a conversation with one of the head teachers, the head teacher mentioned something and I picked up in the conversation. And I'll quote the words that she mentioned. And she put it like this, that every time we receive donated parts, the girls here ask, why does all this feel different? Why is it that they are not the same? And so today, as a speaker, as I speak to you as to why and how participating in the menstrual product standardization in the country and in the ISO TC 38, the picture painted there, I can say that it still remains in my mind up to today. And so for the conversation that we are having today, I must say that it is not a conversation about brand's preference, but it's a conversation of safety. It's a conversation of dignity, because standards are not just documents. And as I put it earlier, they are silent protectors of trust to our people. We are talking about over 1.7 billion menstruating people all over the world. And this one does not really matter where you come from. So if you would allow me, I answer the question why. Is that standard are often seen as just technical document full of clauses, sometimes definitions to others and test methods. But behind every standard today that we have, especially for the menstrual product, there is a story of protection, there is a story of equity and trust. So that makes it very key. So we can say that the menstrual standard protects the user. They ensure that every menstrual product, whether it's a sanitary pad, whether it's a menstrual cup, whether it's a tampon or reusable cloth, all these meet the safety and performance requirements. And so in many and low income countries, like where I come from here in East Africa, in Kenya, you realize that the absence of this standard always exposes our users or the users here to things like infection, irritation, sometimes leakages. And simply because the market is not regulated. So the other thing I would love to mention, secondly, is that standards build confidence. standard build confidence among our people. They give manufacturer clear benchmark to meet, creating a fair and a transparent marketplace, so that if a product is manufactured in Kenya here or in any part of Africa, it can be trusted whether you are selling it either in any part of the developed world. Why? Because this product has met a global standard. So that makes the standard very key, not only to the consumer, but even to those who are in it as a manufacturer. And that, which is also most importantly, the standards for me, I would say that they uphold dignity of a woman.
Thanks, Gilbert.
Yeah.
I think you're raising a very important point of trust and how products being manufactured in developing countries or low and middle income countries also need to build that global trust, and consumer trust and global standards allow for that. So very important point. But I'll now pass the mic to Cynthia to respond to the same question from the perspective of both Kimberly-Clark and Brazil, and also your engagement with both the entities, and where does the importance of standardization lie within that?
Thank you, Tanya. Sure, for sure. I just want to share that I've been participating of the construction of this standard since the beginning of the year, which has been a very exciting experience. I'm part of ABNT also is a standard group that works with standards in Brazil. So it's very important being participating of this discussion. And I just want to bring some background about Brazil population, because we have around 240 million people here, and we have a really important, significant income inequality. Just what we are sharing here, and very inspiring speech from Kevin about his country. We do have some situations with access to education, healthcare, and infrastructure. So it can really vary depending on the region and social groups. So typically the North, I would say North and Northwest are less developed than the South and Southwest. So moving to your question, Tanya, about how menstrual products can be so important to Brazil, is just what we just mentioned about safety, about confidence, about making our export products easier. But it's much more than that. It's bringing technical understanding of menstrual product safety and performance. It allows us to advocate for what reflects our unique needs for our region. So it's very important to be there, to listen to the others, and also to share our thoughts, our learnings, our concern, because it's about safety. Yes, we are talking about safe, but the products must be I have to highlight the importance of the accessibility and the affordability in product design, because this is something very critical for us in addressing period poverty in Latin America. So we have around 6.5% of the population considering extreme poverty here. So it's a lot of people. They are in rural areas, urban peripheries, marginalized communities, and also people in vulnerable social context. So this is very important. We are constructing bridges across cultures, learning, and being participating as Brazil in contributing to this standard is something very unique and important for us here. So moving to your other question, how our being part of the ISO help Brazil to establish this standard. So we do have here trade associations with its ABPEC. You probably know they've been participating a lot of the discussion. So this trade association share all the information that's being discussed with the manufacturers here. So we indirectly can contribute to the standard development. And this is great because in the end, we are ahead of global trends, we are learning, and we are already in advance of what we need to develop locally, because we don't have that much labs. That we have labs, but perhaps not exactly ready for attending the standard. So we are talking now about innovation in country, and this is certainly help us in competitiveness. So everybody being aligned with the knowledge and importance will certainly be contributing to the use of this standard, understanding the reason why and this importance. And also you mentioned, Tanya, this is really about being aligned with international standard, which can certainly facilitate exporting and business, local business. So this is all for myself. Thank you.
Thanks, Cynthia. I think reinforcing what Kelvin had also mentioned, so building consumer trust,
Yeah.
pushing the industry,
Yeah.
building their technical capacity. So all around, I think we are aligned on the fact that it's needed. I'll come to you, Fayaz, now. One speaker where the country is not yet part of ISO TC33, but what are your views on this?
Yeah, thank you, Tanya, and thank you, MHAI, for organizing this event. I think this is a timely event for us, as you were mentioning that we are not yet on the boat of this journey. So I think this learning from others and the information that we will gather today, as we will be sharing it with the other stakeholders, and we'll begin the process of getting onto this boat. So responding to your question about why do the standardization process matters for Bangladesh. And from my experience, I would say that we would take this as a means to the end. And there are several ends actually for Bangladesh, because we want to address the period poverty that we face in our country, that is connected with the harmful traditional practices still happening in Bangladesh. And from the other perspective, the environmental impact of disposable products, that is also a very important issue here. So both the government and the civil society organizations and several UN agencies are working together to first make people aware of this situation, and they are in the process of incorporating the menstrual health and hygiene management issues in the curricula at the primary and higher secondary level, and then promote different safe sanitation facilities, because that would be required when it comes to really make the overall environment enabling others to reach to the end. And definitely, one of the most important factor, as also mentioned by other speakers, is that to develop an affordable product, which would be accessible as well. The accessibility, as some of the previous speakers also mentioned, especially when it comes to a person with disabilities. And we have experienced working with a group of women with disabilities, and found out that the need for them and the kind of product that are required for them are completely different from who are not a person with disability. And a little, if I explain a little further about the health risk, I think what we have seen that using of unhygienic materials and it resulted in reproductive tract infections. So I believe that if we could reach to the point that every product are standardized and accessible to the people, especially the person who needs them, will combat the health risks that may cause. And different research has shown that there are a huge number of girls who don't attend school on the menstrual days. So I believe that will also contribute to this process, and even not the girls, but the women workforce, especially in our ready-made garment industry and other industries, that also affect their productivity. So this will also, I believe, will touch on that issue. And I believe the standardization process will also help us to promote cost-effective and accessible options. So we're looking forward to that. And the final point why we want to be on this boat is about challenging the social stigma. Because if different stakeholders will participate in this process, and that I believe will naturally will trigger a national level awareness or sensitization process, and different stakeholders would be engaged to complete this process and maintain this process. So this process itself will be an education process for everyone. So these are the few important and I would say major facts that why we want to get onto this boat. Yeah, over to you.
Thanks, Faz. I think it's a learning journey for all stakeholders involved. You're right. And so on stakeholders, Francisca, maybe you can help us understand a little bit, because from the perspective of a national standards body, what type of stakeholders is it important for the NSB to engage in the process, and why? And just what's the diversity of stakeholders in your experience has been important for Ghana also to look at this issue?
Well, thank you very much, Tanya. So for us here in Ghana, our committees are open to all. Anyone with an interest in participating in the committee, you're welcome to be part of a committee. However, there are some particular stakeholders that we always have on board. And that is because of the wealth of expertise and knowledge that they have. And also because standards are also basis on which policies are made. We also need to bring on board some of these policymakers, regulators, to ensure that we just don't develop the standards. At the end of the day, we can get policies out of it, and we have the regulators buy in to be able to implement the standards that has been developed. And so for us, first of all, we have the academia and the research institutions on board. This is because the academia have a wealth of knowledge when it comes to some of these products. They actually teach the production and then the literature bits of these a lot of research.
Francisca, we are losing you.
So we always bring them on board. We also have on board of the standards being published.
Francisca, we are losing your
and so we always have regulators on board. Then we also have.
You're losing your audio a little bit. Maybe it'll help if you.
Okay, is it better now?
It's pausing, so maybe shut your video, might help.
And these are bodies that are into the analysis of the products. So they analyze the products to ensure that they are meeting the requirements of the standards, like the also give certification to manufacturers against the standard that has been developed. We bring on board NGOs as well. Being a great force here in Ghana. They actually started the push for the standard. And this is because, can you hear me?
We are losing you in the middle, so might be helpful if you shut your video.
Hello, can you hear me?
Yeah, just continue. Yes, now I think just
okay.
continue.
So we have the
You were talking about the NGOs that started the push for the standards.
the NGOs on board. And this is because push for the standard. And when they realize that there's a high influx of these products on our markets, and there are no standards to guide the operations of these manufacturers or people bringing in these products on our markets. And so they usually are part of discussions. They also do a lot of research. They go into the rural areas, the rural settings. They engage people or users of the products one-on-one. And so they get good feedback from them. Once we have them on board, they bring those feedback as part of the discussions on the committee. And so we always have the NGOs on board of our committees. Then we have policymakers, the ministries, Ministry of Gender, ministries that are taking care of trade. We have them on board. And this is because, as I indicated, once the standards are in place, we need them to ensure that we have policies in place to for the implementation of the standards. If they are part of discussions and they understand the issues that are being discussed, it's very easy for them to push for some of these policies to be in place. We also have on board manufacturers, the people that are producing themselves. They come on board, we all discuss, they know what they are producing, they know the raw materials they are using, they know how they are going about their production. And so if they are part of discussions, at the end of the day, it's very easy for them to implement the requirements that together collectively as a committee we have put together. These are people that we usually bring, or stakeholders that we usually have on board our committee. And Ghana Standards Authority, or the NSB, we are always part of the committee to facilitate discussions and ensure that at the end of the day, we discuss and reach consensus and publish the document as a national document. So these are usually stakeholders that we have on board our committees. And looking at things, it's not really any difference with what we have elsewhere. Usually we go with the good standardization practices being implemented by the ISO. Thank you.
Thanks, Francisca. That is indeed a diverse array of stakeholders that you mentioned here. And Fayaz, I would like to come to you now and ask that, since you are starting to potentially look at this issue and looking at also advocacy journeys in other public health areas, which additional stakeholders do you think might be helpful in supporting this effort in Bangladesh or even otherwise?
Yeah, I think what I have heard from Francisca is relevant for Bangladesh as well. But before coming to that, I think let me share some of the other important issues that I think would be useful for the other participants and the everyone in general. So in Bangladesh, actually, the CSOs and the CSO leaders actually led the whole movement of, if I put it as a movement, for menstrual health and hygiene management, acknowledging that first as an issue, and as an issue which you can speak publicly, because as I was mentioning about the taboo, especially in the South Asian countries, it is not very easy and comfortable for everyone to even 5 or 10 years back, it was not that easy. So the civil society as the prime stakeholder in this scenario, they advocated with the government of Bangladesh, and then the National Menstrual Hygiene Management Strategy was adopted in 2021, and that strategy actually, give the space of forming a national MHM coordination committee. And that committee is with all the relevant government agencies, starting from the ministries to the local level departments, as and when relevant, and the civil society organizations itself. So this coordination committee is the highest level of body to discuss and plan for different actions. And I should also mention that the strategy itself, give priority to standardize the products and ensure quality products for the citizens. So apart from that, and the institute that will be relevant for in our case is the Bangladesh Standard and Testing Institutions, BSTI. So as the national committee has someone from the BSTI as well. So when the process will start, this agency will come into action naturally. But the other thing that we have as a civil society forum, we call it the National MHM Platform, and that is a platform of around 100 civil society organizations, UN agencies, even private sector companies, social entrepreneurs. So this whole community will be and are working as a workforce or a pressure group to ensure that this process is followed, the strategy being implemented. If I categorize the stakeholder into different groups, starting from the users itself, because I believe they are the prime stakeholder in this case, and often we focus more on the government and other stakeholders than the user itself. So I believe engagement of the users, especially the girls, the women, especially people, women and girls in the vulnerable populations who are living in marginalized conditions, they would be really important as a stakeholder. Also the health and medical professionals, because they will be the person who will be guiding or kind of motivating or consulting with the users. Then naturally, as Francisco also mentioned, the government and regulatory bodies. So they will be because the ISO process itself is depend on the role and the responsibility of the national standard body. So I think they will play the key role here. But as I mentioned, the users will be an important part. Also, the private sector, the manufacturers, the producers, the retailers, suppliers, the whole product value chain. If they are not involved in this process from the day one or the day zero, then when the actual product will come into the market, it will be come through them and then will be distributed through them as well. So they will be the main group of people with the users. Regulators may not come in a day-to-day need. So that will be really important. There's also a very important thing, I think, what we need to acknowledge. I don't know about the other countries. I would look forward to learning from them about the recycling and waste management industry, because disposing of these products will be very critical, when it comes to environment. So that knowledge would be really useful for us. And last but not least, the civil society organization, as I was mentioning, that they are already playing an important role here. And I believe that in the days to come, when we'll start our journey, even from now on, I think they will play an important role, as the kind of a doorkeeper, gatekeeper, to ensure that we reach the destination. Thank you. Over to you, Tanya.
Thanks, Fayaz. I think what you shared is you have the policy framework, you have the right stakeholders in place. You also now clearly have the willingness to work on this issue as well. So we're just waiting to see what wonders lead to. No pressure. I'll come to Kelvin, you now for a last question. That there is obviously certain stakeholders who are participating within the ISO group, but then there is a much wider group of stakeholders that are engaged at the country level. And since Kenya hosted the last ISO TC 338 meeting, this wider group of stakeholders could engage. But on a regular basis, how does an NSB or how do other platforms ensure that the wider group of stakeholders is also providing input to the ISO process? And after Kelvin, Cynthia, if you could answer the same question from your perspective from ABPEC.
Absolutely.
Yeah.
Thank you.
Yeah, thank you, Tanya, for the question. And indeed, it was a great thing. It was really a great thing that the ISO TC338 was able to host the global event that happened here in the country early in the beginning of the year. So now, if I am to come to the question, here in the country, here in Kenya, we usually work under Kenya Bureau of Standards. It's KEBS. And in Kenya Bureau of Standards, we have a technical committee, TC69, which is usually led by our chair, who I must acknowledge here, that is Dr. Simon Kigondu, who has been the TC chair for years now. And now how we work, if I may answer that also, is that in this TC, it incorporates different stakeholders, because we don't want to be at a place where experts meet and then they will not take the view of other stakeholders who are very key to this process. So this document, to ensure that the standard is embraced by even the people, because the technical expert, as much as they would sit the scientists and all those people who are considered as experts and come up with this document, we need a collaboration with other stakeholders. And here I might say that as many speakers have mentioned, in the technical committee TC69 here in Kenya, it comprises of different stakeholders, depending from regulators, the non-governmental organization. We have representation from manufacturers. We have a representation from all across, so that once the standard is being drafted, the views of all these stakeholders are accepted. And because you will understand that once the technical document or the standard is developed, remember the user on the other side. There is a bridge between the Kenya Bureau of Standard or the regulatory body and the user. So by bringing in all these other stakeholders, then they become the bridge. They become the bridge to the user, because the needs of the user here, if I may say also, need to be incorporated. And because it is not possible to incorporate all these users in the TC, then all these other stakeholders represents the interest of the user, and whereby that after the product is made, which have met this standard, the product is easily accepted in the market. And I will agree with maybe other speakers as I finish, that even here in Kenya, in Africa here, we still face different challenges. I know I can say without fear that we still have areas that this menstrual health is considered as a taboo thing, is considered as a girl, a woman issue, whereby during these days, you will find that in some areas, some marginalized areas, these women will be kept aside. And you see now, by incorporating all these team players in the technical committee, we bring them to adopt these ideas so that when they go back there, they can educate the people that, you see, menstrual health is not a luxury for women. It's all about basic life for all of us as a people. And so it's very, very important. And I think having all these stakeholders together here in Kenya, led or working together under the technical committee umbrella led by the Kenya Bureau of Standards, becomes a very key role for us as a country, even as we join the ALSO and the rest of the East Africa on this goal. Thank you. Back to you, Tanya.
Thanks, Kelvin. So country level consultations still hold a very important role, because not everyone can be present as part of the TC. Cynthia, over to you to talk about how you guys have been doing this through ABPEC.
Thank you very much. I would say that you guys said everything basically is similar to what we are doing here. You spoke brilliantly, thanks. So in Brazil, we do have a regulation, right? So through ABPEC, we are engaging the other manufacturers. This is how we are communicating and informing them how we are progressing with the standard and having their feedbacks on how it could increase their knowledge or how they could implement in their process. This is something complex. because they need to understand the reason why. And for that, together with the ABPAC, we are having constantly meetings with the group. So once we have information, we have this share information with them and engaging and let them know. And sometimes we know that we are already involved. So they received the documents, they are reading, and they came with the questions, which is wonderful, because we can see that it's not only us or ABPAC that is sharing, but they also by themselves checking and comparing and see what's happening and bringing their opinions, suggestions, and concerns. What I would add to this discussion is that it's really important to have a plan. Once we have a short time and long time, what we are going to do during this period, and what's the efforts that everyone will do in order to be engaged naturally. Because the reason why we are doing everything is really to get them together with us in the construction and the development of this document, so then can be using it naturally, organically, so we don't have to force anyone to use. So once they are together, they are using in the future, and this will be spread around the world, around Brazil and everywhere. So also suggesting some trainings, online trainings from this group, all groups, because this must be something to be very natural. We need to turn this conversation natural to everyone. This is not a stigma, this is something to be spoken, we have to talk about. And it's very important to be transparent and simplify it, and especially if we can have in the future documents in different languages, because it's true that it's not everyone speaks English. So how to engage by having documents in different languages? We know that currently we have lots of tools where we can translate it easily, but it's not exactly the best way to engage. When we receive a document in Portuguese, for instance, I say, wow, we are important. So we are important, this is in Portuguese. So it's something that brings us much more energy to use this document, to read the entire document, and to spread these paragraphs and share, and then this is really, really nice. And also, I would suggest to have maintaining a strong feedback. So having feedbacks from locally and internationally, this would certainly become more inclusive and transparent and responsive to real world needs, because our concern is really of the safety of the women of those who menstruate, and we know that we have lots of gaps in terms of information, and this is what we want to solve. So turn to you, Tanya. Thank you.
Yeah, wonderful. I think all of you have said it very well, that standardization is important, and then engagement of NSBs at the ISO level is important. But then so is engagement of stakeholders at the national level. So there can be constant flow of information both ways, from those stakeholders into the ISO process, and then vice versa. And for that, I think some of the considerations you shared in terms of language, in terms of context appropriateness, just simplifying some of the content might be helpful. And I hope my colleagues at CIS, who lead some of the work around communication, etc., may be listening to this and would take note of this. So thank you. That's very, very helpful. We are actually at time for the panel. So I really want to thank all of you. We lost Kelvin along the way. I think he lost his connection, but I think he already shared a lot of good insights. We do have a few questions for the speakers, and I'll pass on the mic to my colleague Soumya to share some of those before we go into the break. And thank you to the brilliant first panel for sharing your insights. Really appreciate it.
Thank you, Tanya. Thank you. Very interesting conversations. We had so much of discussions happening parallelly in the chat box. So many people were appreciating what the speakers were saying, were actually agreeing to them. And also, there are a few questions that came up, and there are two that specifically we were able to pick up, and we want our speakers, if they can share their answers for it. The first one, I think, will while Cynthia and Fayaz, you can also add your comments, but I think this could be directed to Francisca. And one of the participants have asked that if a country is not participating in ISO TC 338, how would they approach their NSB to initiate this engagement? So what they can do in their own country so that their countries can engage with ISO's processes. So Francisca, if you can.
Yes, thank you very much, Sina. So, if a country is not a member, a P member of the ISO 338, however, as a stakeholder within the country, you have an
Yeah, I think Francisca, we cannot hear you.
kindly need to
Maybe-
identify your NSM. You can officially write to them or work to the reason why you think that is very important for the country to participate in ISO 338. And if that is done, the country would register as a P member and register you as an expert on any of the working groups. And then you can start participating. So kindly engage your NSBs on how best they can be P members of the ISO 338. And then you can take up be an expert on the committee. The NSB would also have to set up a national mirror committee to ensure that it's not just you, the stakeholder, who is participating. They need to identify all other relevant stakeholders within the country, and then they can all come together and participate in the decision-making of the ISO 338. I wanted to also chip in, one important stakeholder is the consumers, people who actually use the products. Okay, so during one of our stakeholder engagements, we actually engaged school children or school girls who actually use the products. And the feedback we got was so interesting. I mean, they use the product, they know what they want, they know the in and out of the product. And so bringing them on board and for them to share their experiences and the feedback, it was so good. And I think that countries should also identify consumers, people are using the product within the countries, and bring them on board. Let's discuss the standard with them. What would they want to see as a requirement in the product in terms of design, and then any other aspects of the products, because they are the ones going to use the products. Thank you.
I think
Thank you,
that's
Francisca.
such an interesting point, Francisca, because it's also response to, I think, Ken's question in the chat box that it's possibly another way of consumer education and integrating that into the standards development process. And again, that's another piece that can be done at the national level, which can feed into the ISO process, even though consumers cannot directly be present at the ISO level. Sorry, back to you, Soumya.
Yes, we have many more questions coming up. So
Maybe
it's
one
time,
more.
I think we can take one more. Okay, so we have one very interesting. So somebody in the chat box mentioned that they are piloting an AI-powered solution, and they wanted to know if there would be an ongoing efforts to integrate consumer feedback or digital monitoring systems like AI tools into product quality assurance. And Cynthia, maybe you or Kelvin would like to answer this.
That's a good question. So having the user of feedback from the tools is something that's very important to collect information of what's being said or being the questions that comes from the community, right? So we are not monitoring the AI, the international, this kind of tools, but certainly we could use it as something important to share information with everyone, answer questions, and also collect information. So translation is something that we always have to check, especially because we can find many things that are wrong, or explanation or understanding that are not correct. I would suggest always to have in mind about when you want to know this kind of information, try to find ways or websites, this group of people to discuss and to share, because we are always in an ongoing journey in terms of learning, in terms of collecting and getting better. So this is a document that is being constructed now, but for the future, for sure, we'll have much more that comes from the scientific community. And will change, certainly will change, which is good because we are always changing for the better. And eventually this first version is not considering everything. So how we can, for the second time, turn it and update everything that we have. So hopefully I could answer, I don't know if the others from the panel have something more to add. Thank you.
And just because we are all at time, Fayaz, maybe just a quick remark and then we'll need to close.
Yeah, I'll briefly share an update with everyone. On the excuse me, on the national MHM platform, we have launched a mobile application, and the purpose of this application is actually multiple. First one is to inform and educate the anyone, from a schoolgirl to a working woman, everyone, and that is in that an AI chatbot is integrated to that mobile application, so that anyone individually can ask a question and have response to it, and a group of experts from medical doctor to technical experts are working behind this. And the other thing that we have done through this application is to calculate, so an individual could calculate her menstrual cycle through this application and have reminder of taking different steps. Different health tips are also incorporated in this, and we already have tested it into different schools in the rural areas, so that if the rural area girls and adolescent girls who are there could use it effectively, then we'll scale it up to the national level, and we are talking with the government to mainstream it through the education ministry. Yeah, over to you.
Great, thank you. So I think that's all for panel 1, and we will take a quick 5-minute break. Special thank you to all our speakers who have joined from very different time zones, Cynthia, especially very early in the morning. Thank you for joining us. And we'll take a quick 5-minute break, during which Soumya will be sharing some additional information. If you're interested, please stick around, but otherwise we'll meet you back in 5 minutes for the next panel discussion. Thank you.
Thank you, everyone.
Tana, can you pull up the poster for Days for Girls conference? Yes, so what you see in front of you is a poster. On November 20th, Days for Girls Nepal and Swedish Institute of Standards is hosting a national menstrual health conference in Nepal. This will be featuring the breadth of work that is taking place in Nepal, and will be having many sessions on different programs and policy approaches to menstrual health. The morning session is about menstrual product standardization with presentations and activities from ISO TC 338 members also. This session is going to take place in Kathmandu, and you can attend it both in person and virtually. We are sharing the registration and detail link on the chat box. You can actually visit it. Can we have the link? Yeah.
Otherwise, it's also there up on the poster itself.
Yes. I'm quickly just posting the link for the event as well. And we also have a video. It's a very short video from ISO TC338.
You'll have to stop sharing and I can share the video.
Thanks, Arundhati. We can also post the link to the video on the chat box. I'd also like to quickly remind everyone here that we will be sharing the recording of the webinar with key insights with everybody post the webinar. And you can share your questions after on the chat box. And during the Q&A sessions, we will be posing those questions to the speakers.
We'll just start with the next session in 2 minutes. Please don't log off. Stay with us. We'll just give our participants to take a chance to take a break. Go to the loo, get a glass of water, tea, coffee, and join us again, refreshed. Okay, in the meantime, Arundhati, why don't you start us off with the Zoom poll for the next session, and whoever's around can maybe start responding to that.
Yes, will do. Launching it now. Should be able to see the Zoom poll questions now, and we have 2 in this one.
Thank you.
Okay, hi Tanya. Perhaps you could just welcome everyone back and draw attention to the poll, and then we can close.
Yes, thank you. Okay. Thanks for sticking around, everybody. So interesting. We do have some people who were still around in the break who have responded. So the first question we asked was, would you want to support your national standards body in the creation of menstrual product standards? And participation in ISO TC 338. And we have an overwhelming yes, 92% responded yes. And the way to do that is to contact your national standards body. Please use materials available on the ISO TC 338 website to support that effort. Collective outreach does help, working with other stakeholders, whether it's manufacturers, advocacy organizations, civil society, and jointly reaching out will strengthen your case. But please reach out to your national standards body because that is the starting point for your engagement with the menstrual product standardization work. Not every individual can be on the ISO TC 338 table, but all voices can be incorporated and be reflected through the national standards bodies. The second question we had was, which regional or national platforms can be used for collectivizing stakeholders for advocacy on menstrual product standards? And we asked this question because we'll go into the next panel, actually, which will talk about adoption and rollout of menstrual product standards. And some of these platforms are actually very important for this effort. Arundhati, are you able to see some of the responses?
Unfortunately, I can't see the responses. I think when we complete this is when we'll be able to do that. So we can share this in the report.
Sorry about that, but we will share those responses with you guys, but maybe a better source of information on that is our next panel. So I'll quickly introduce our next panel. Sorry about that. Yeah. So we have four very diverse and again, experts in their field, fields participating here on our panel too today, again from across the world. We have Selena Perez from FemCare in Sri Lanka. Selena is a lawyer, social entrepreneur, and director at Selin Group, Sri Lanka's leading fair trade enterprise. She supported global advocacy on menstrual health through their Bleed Good initiative, and also introduced high-quality reusable menstrual product solutions in Sri Lanka through the enterprise. We then have Shiva Kumarji, who's joined us from the South Indian Textile Research Association in India. Shiva Kumarji is the Principal Scientific Officer and the Head of Textile Chemistry at Citra, with 25 years of expertise spanning textile quality assurance, R&D, sustainability, and greener processing. Shiva Kumarji has driven innovation across benchmarking, standardization, and capacity building initiatives. Then we have Dr. Zainab Umar joining us from Nigeria, from the Standards Organization of Nigeria. Dr. Zainab Umar is an assistant director at SON, the Standards Organization of Nigeria, where she heads the African Organization for Standardization, or the ARSO desk, one of the regional bodies that I mentioned earlier, in the Standards Development Department. And Zainab brings over 15 years of experience in national, regional, and international standardization. Welcome, Dr. Zainab. And last but definitely not the least, we have Raisa Isha Putri from Perfect Fit Indonesia. And Isha is the co-founder and COO of Perfect Fit, which is a women-led social enterprise providing sustainable menstrual solutions to women and girls in Indonesia. She has over 7 years of experience in the menstrual health industry, and she's extensively worked amongst rural communities on women's empowerment initiatives. So thanks for joining us, and I'll request colleagues to spotlight all the speakers. Thank you so much. So let's without wasting time, let's get into the discussion. We had some interesting insights from our first panel on why standards matter and why should individuals, organizations, NSBs, different stakeholders work towards NSBs participating in ISO TC 338. But this panel will focus on what does it mean when the ISO TC 338 publishes its standards, how they will be adopted and rolled out in countries, and what does that mean in terms of readiness, preparedness, etc. So first question I'll pose to you, Dr. Zainab. What do you think are the important regulatory frameworks that your country particularly, but any country should consider, and maybe Nigeria has considered to be ready for the rollout? And that could mean policy frameworks, policy windows, anything.
Okay, thank you very much, Tanya, and I'm delighted to be part of the diverse expert speakers from different countries. Nigeria has frameworks, existing frameworks that will effectively that will be effectively used in the rollout and implement and the adoption and rollout of the standard ISO standard on menstrual health. Looking at the Nigerian National Agency for Food and Drug regulations, and also which regulates the safety, quality, and efficacy of the health product, including menstrual health and sanitary products. Also responsible for the registration and quality control and market authority of the product. Then we have the Standards Organization of Nigeria, which responsible for the development, promotion, and enforcement of the standard, include a national standard, including menstrual health standard, and also they are responsible for the certification of the menstrual product. Also, the they are responsible for participating in the harmonization of the standard at the regional and international organizations, including participating in the menstrual health standard. Also, we have the NESRA, that is the national. We have the NESRE, which is the National Environmental Standards and Regulations Enforcement Agency, which also deals with the environmental protection and the enforcement of law and regulations. They're given at the environmental concern on the sanitary products, menstrual health product waste, and environmental impact. They are responsible for developing guidelines on those areas to ensure management of waste and environmental impacts are covered. Then we have the Consumer Health Act, and we have the Public Health Act and Consumer Protection Rights, which ensures that those menstrual health products are produced in hygienic. They are produced in hygienic way and marketed, and also they strengthen the provision related to related to product hygiene and consumer safety on the menstrual health products. Right, this regulatory agencies ensures that that when this when these standards are approved, it can be easily rolled out in the country. And also of recent, we have the menstrual health and hygienic management framework, a policy framework, which has been validated. And I think with this standard, it can help in translating the implementation of the policy in Nigeria. Thank you.
Thanks, Dr. Zainab. I think that's a really good window that the MHHM policy was recently validated. And so there's definitely good that potentially Standards Organization of Nigeria could be looking to integrate standards within that policy itself. Selena, maybe you could look at the same question and from Sri Lanka's perspective, Sri Lanka has single-use pad standards and but reusable standards are also being created. What does that mean for adoption of an ISO standard once created?
Yeah. So thank you, Tanya, and thanks for having me as well. Just also want to note before I start that I am part of the NMC developing the reusable standard in Sri Lanka, but I'm here speaking as director of FemCare and on my learnings during this process and do not reflect kind of or represent the committee per se. So if I can kind of say it in this way, and also bridging from the first panel, that a rollout plan should really be formulated at the development stage. And why I say that, and maybe some of the things that the others didn't pick on as well, was that when creating the standard, our standard is as draft stage as yet. It's still to be finalized, the reusable standard. And we, in particular, considered frameworks and benchmarks from LMIC countries. So we made certain that even though there's a tendency to look into kind of the more European or US standards, we made it a point to look into the Indian standard, the Kenyan standard, the South African standard, because we felt that when rolling out, it was going to be necessary to draw that context of why this standard was created. So it is the same when rolling out an ISO standard. Then very rightly, as this conversation is all about, considering that LMIC context and having those views represented become very important for rollout. So, and also to say, having the right people in the room right from the start, the regulators and the ecosystem is crucial for rollout. So we were able, not directly via the NMC, but to advocate for the inclusion of menstruation in the national health strategy, for instance. We were invited because of the work that we currently do in Sri Lanka, and that was a huge win because menstruation was not in the national health strategy as a standalone subject. And in that sense, we were also able to really look to raise awareness around the standards, around the process, and also look into the globe about what's already happening, right? So I think these are kind of the things that are very important from the start, from the formulation stage to be ready for rollout. And in that sense, when I said having the right people in the room, absolutely the health community, the medical community goes without saying. And then, of course, we already spoke about the Consumer Affairs Authority, the NMRA where needed. But maybe a segment that is often left out are the civil society organizations who perhaps don't have that inroad into the NMCs due to the lack of a perceived like a perception around the lack of technical knowledge to actually contribute to standard making. And I think this becomes an issue because when you are rolling out, you do need those insights from the ground to have been considered all the way from the start. So this I find has been a gap, at least in the Sri Lanka process. And perhaps even in the ISO process, I don't know to what extent we are going out of our way to really include not just perspectives, but also data that is gathered on the ground. So I think this becomes a kind of a subject on its own to consider when rolling out. A little outside the regulatory frameworks that you asked me to comment on, Tanya, but I think it's very important because it connects to the entire rollout and the adoption of the policy. And maybe two last points to say that often gets overlooked is that when considering rollout, also engaging kind of the procurement frameworks in the country. especially because menstrual products and now increasingly reusable products are considered for government school programs, for programs in low-income areas. It's really important that these procurement frameworks are engaged in order to align those standards with what is incoming, not just locally, but also globally. And I don't see that connection being made, at least in the Sri Lanka space. And also, this is the same with the environment. There was I think our colleague from Bangladesh mentioned menstrual waste, the environment. Our colleague from Nigeria said the same thing. Again, an absolutely overlooked area when we come to look at menstruation, standardization of menstrual products. The actual environment is very much overlooked. And we all know that product going into landfills, which are not incinerated or not looked after or disposed in the correct manner, does cause issues that do affect women and young girls and young children. So again, a critical link to be looking at when considering rollout. And maybe one of the last things to say is that we started off with a poll that really spoke about consumer safety being the core of standard making. And in that sense, the education and awareness piece, engaging the Health Promotion Bureau, for instance, in Sri Lanka, was part of the committee and has been heavily involved in raising awareness around safety, usability, the environmental side of things, the SRHR side of things. So they become very critical stakeholders and frameworks to engage with. And finally, like I already said, how the civil society can really come into this, especially those working on the ground, becomes crucial when we are to look at rollout of any standard, be it national or global.
Thanks, Elena. So I think you bring up some important perspectives, as did Dr. Zainab, about one, the government stakeholders, and there's not any one government stakeholder, there is a variety, and all of them need to be brought into the conversation for the adoption to be multifaceted and adopted at different levels. And you also mentioned other stakeholders and did say civil society, but I think there's another one which does get overlooked is SMEs and SMEs like yourself for that matter. And so I'll go to Icha now and ask about the SMEs, because you yourself are an SME and Indonesia is now part of ISO TC 338, even though it's an observing member, not a participating member. But how do you think, being an SME in the country, how do you think working with different collectives or associations, or what are those platforms where an SME can actually come together with others to contribute to the standards development processes? Are there platforms available, or is there need for SMEs to engage with the civil society to come together in a collective format?
Yeah, thank you so much, Tanya, for having me in the panel. I'm honored to share the time with you all. So as the background in Indonesia, we technically have already a national standard for single-use pads, but it's more than 20 years old now, and it doesn't cover all of it. Doesn't cover the chemical safety of or any new materials that brands are now using, like ourselves. We use bamboo fibers and bio-based materials. And most importantly, it doesn't apply for usable products like period underwear, menstrual cups, and cloth pads, because we also have a diverse products, not only single-use organic pads, but also reusable products available in Indonesia. And even though this standard exists, it's not fully enforced as well. We do have required certification from Ministry of Health to import single-use pad, but it's more like a health permit rather than a full compliance. So there's already a gap between what's written and what's implemented. So hopefully, like if it's rolled out, it's also being implemented. And now this is exactly where I think collective and association can play important role. As a small enterprise, we don't have the same access or influence as large corporation, right? So by working together through industry groups or civil society networks, we can help raise awareness of what good standards look like, both among consumers and regulators. We have several organizations alike that works in menstrual health and SRHR issues for quite some time now. And we also part of the alliance in Indonesia, so we can continue building that momentum moving forward. And I agree on what Selina's remarks earlier. You point out a lot of like engaging feedback, and also how we can use data-driven information to be put in the ISO. So when consumer understand the standards, like why it's important, like chemical safety or biocompatibility, they can begin to demand that brands follow them. That market awareness creates pressure and incentive for better compliance. I think this is also important. And I agree this process should include feedback mechanism where both customer and brands can give us input on whether standards actually meet the needs of women in the country, because we have a different socioeconomic status, and then different I think different myths, stigmas, and etc. For example, like a lot of Asian countries, it's very difficult to adopt menstrual cups, right? Because we're not used to tampons. So this is like a question that we should ask: are they culturally relevant? Are they inclusive or diverse user that can use? So that dialogue is also crucial for making standard meaningful rather than just technical. Thank you.
Thanks, Isha. That's important, and I think the ISO TC 338 has followed an informed choice approach where the technical standards are being developed for all categories of products. So, wherever relevant, at least those technical standards are available for the countries to adopt and should be adopted. I'll come back to you, Dr. Zainab. On collectivization, we spoke about SMEs. But even at a regional level, national standards bodies are able to collectivize, and in West Africa, Nigeria, and you per se play an active role in engaging with ARSO, with the African Standards Organization. So how can collectives or regional, standards bodies and networks support in adoption of the ISO standard in a region, and we can take the example of West Africa and otherwise as well.
Okay, thank you, Tanya. The collectivization at the regional level helps a lot in the rolling out of the standard, where diverse members of country comes together to harmonize standard at the regional level, which this standard helps in reducing the technical barrier to trade, improve quality of the product, and then foster economic growth. So this member countries participate actively by appointing members, diverse stakeholders, including the SMEs, to participate in the harmonization of the standard, which in the harmonization of the standard. And in Nigeria, we have principles and procedure for development of standard that embodies that, to ensure that relevant stakeholders are engaged in the participation, starting from the onset of the standard till the end of the standard. And then this collective action, this collective participation makes the stakeholders to take ownership of the resulting standard. And in doing that, take ownership because they have been engaged from the starting point to the end. And it makes the implementation of the standard much more easier, since they are aware of what is needed of the standard, and they have been engaged throughout the standardization process. And then also the feedback mechanism by circulating the standard with the stakeholders participating in the TC. It also couples with the sharing, coupled with the sharing of the information and getting feedback from the stakeholders and return and compiling it as the national position of the country also helps in the, also that can help in the rollout of the standard at the regional level,
Thank
Thank
you.
you.
Thank you. So I think with Nigeria being part of the work now, we can see how there can be a regional leadership, so to speak, on menstrual product standards, at least in the West African region, and with Ghana also being part of the Twin Secretariat, there's opportunity to join forces, definitely. Shivakumarji, I'll come to you now. Given you're also actively participating in the ISO-TC 338 as a convener of the working group, looking at general and safety requirements, which is pretty much the meat of the work. What are the technical areas you feel that countries may actually face challenges in when they are going to do the testing, and some of the requirements that may be challenging to actually implement when it comes to rollout, and how can these gaps be addressed in your mind?
Thank you, Tanya ma'am, and thanks for including me in this webinar. It's my pleasure to be here amongst the various stakeholders in the menstrual product standardization and its rollout. So we are currently, working on a draft standard titled General and Safety Requirements of Menstrual Products. And we also understand, we get to understand from various meetings that we have conducted so far of the WG1 and things like that. There are some gaps to be addressed, mainly when we talk about, biocompatibility, like, skin irritation, sensitization. So what I also understand from the members is that there is no proper supply chain in some of the countries for sourcing the raw materials, and when they source from some other countries or in some other places, probably they may not be able to ensure the quality of the raw materials per se, especially when it comes to externally owned reusable products. There is a case actually for them to ensure the quality of such products. Further, I mean to say the laboratory setup is not there in some of these countries, and I also understand from them there is a lack of technical expertise when it comes to conducting the safety assessment, the toxicological screening, because this ISO standard per se looks at not mandating tests as such, but trying to cover it through the safety assessments like IBRA process, the exposure-based risk assessment process, and things like that. But we, due to this gap, it is also necessary for the standard to mention some of those mandatory tests as a bare minimum requirement, as a safety point of view. Having various stakeholders in mind, the user, the regulator, and also the manufacturer in place. So given that the challenges would be probably with the biocompatibility aspects, the conducting skin irritation and sensitization, I don't see any problem with regard to conducting testing of cytotoxicity, because it doesn't involve much investment. If you ask the laboratories, if there is a potential, any lab would be willing to set up the facility for it. That is it is kind of a chicken and egg scenario. If there is a need, definitely labs would be also willing to. There are multinational laboratories who can, for them this investment isn't a big deal. And one more thing, for chemical safety also, I understand, for instance, if you want to test heavy metals in textile materials or some other materials, you need to probably have ICP-MS, which is costing about 2 lakh US dollars per se, and there are other instruments like GCMS, MS, because given the scenario that the limit values are bringing down, are being brought down to the level which require higher level of instrumentation. So this could also be a challenge when it comes to implementation of the standard. But I'm sure, like with various engagement of various stakeholders and the supports from the government, it can easily be tackled. But this committee looks at it, putting it only the minimum requirements to be met, not overburdening the manufacturers and also the consumers, by the way. But what is more important for this committee is to ensure the safety of the user. So I hope this has addressed your query, and I think if you want me to talk about how we can address these gaps, perhaps with regard to the toxicological screening, we definitely need to have expertise within the country where so once the standard is rolled out, I hope definitely the national standards body will have reach out programs. In India, in BIS is conducting capsule courses on specific standards. As such, they conduct standard outreach programs or the capsule programs for particular standard. For example, polyester sewing thread or polyester thread, they conduct one program exclusively for that. And if there is a reusable or a disposable menstrual product, they conduct one specific program for the standard. So this is how I think we can also disseminate. And for training toxicological experts, it is also ideal that we have training courses. It can also be organized by NGOs or institutions like IFC. During COVID time, I recall IFC, International Finance Corporation, has volunteered to conduct such capacity building programs about various test methods for PPEs and medical textiles. It was also done in collaboration with BSI, and in fact, BIS has also contributed such programs during this COVID time for dissemination of such information. We also have programs from BIS like Manak Manthan, where they talk about different standards. They take one standard in for a week and they talk about that standard in detail to the stakeholders. And for laboratory, for enhancing the laboratory setup, as I told you, most of the private laboratories would be definitely be willing to offer, to establish their capacity if there is a potential, if the standards are made mandatory or if the manufacturers are sufficiently available. But to encourage government laboratories, there could be some funding opportunities through World Bank maybe, or through the respective governments. They can also fund establishing such facilities where the fund support is required. So I think
Thanks.
this is more or less. Thank you.
I think for government laboratories, you've also, in one of our conversations, you've mentioned that there are technical partnerships that are also possible, or tech transfer kind of arrangements that can allow for working with upskilling of government laboratories and institutions. If you can give us an example, that would be great.
Yeah, I think this is not specific to menstrual products, but Citra has done, during COVID time and after that also, we have done technology transfer to other country laboratories. For instance, Philippines Textile Research Institution approached Citra for establishing a facility for themselves. They asked the technology transfer or the support of Citra in establishing the laboratory for testing of medical textiles, and we have helped them online, how to carry out the testing, and what are the instruments that are required, how a laboratory should look like, what is the layout, and what kind of instruments to be purchased, what are the specifications, and how to interpret the results, and what are the technicalities of a product per se. Before going into the testing, they should also have a background information about how it is done. So the government support, like even I also understand there are international agencies which are willing to take up this and fund for technology transfer. There is International Finance Corporation is one such example. They volunteered during the COVID time to establish such facilities. They conducted capacity building programs. They have even volunteered to set up, help setting up of laboratories in different places. So there are such arrangements are available, but with more interactions like this, in a forum like this, and a contribution or a initiative from a NGO like you, definitely it can be propelled further.
Thank you, Shiv.
Over to you.
So that's great. I think a lot will be needed on the labs and technical expertise of institutes on that side. And I'll come to Isha, you and Selena, both of you, on what do you think will be needed in terms of industry, especially SMEs? What kind of capacity building might be needed there for adoption and rollout of standards once they're there, especially in a context where standards may not have been mandatory or they might not have been required to meet them. And do you see a role for partnerships with stakeholders in other countries potentially for strengthening this? So Isha, maybe you can go first, and Selena.
Yeah, this is an area that I've thought a lot about. So when we talk about menstrual standard, most people immediately think about compliance or lab testing. But the foundation really begins with technical literacy within the companies themselves. As a small enterprise myself, especially in the menstrual health sector in Southeast Asia, are funded mostly by passionate social entrepreneurs rather than engineers or chemists. So we don't have like a knowledge of that. So building capacity means teaching teams how to interpret the standards and understanding the material safety, also document their production process in a way that can be validated later. And as a small enterprise, we also face real resource limitation. I think Dr. Siva Kumar mentioned about some of the lab testing are quite expensive. And a lot of time we need to rely on our manufacturer's certification for certain components. We did actually test our period underwear for PFAS-free certification because chemical safety is such a critical issue for menstrual products. While this approach helps us ensure product safety, it also highlights the needs for more accessible and affordable testing pathways for small businesses like ours. In Indonesia, there are few existing labs, external parties that can test menstrual products, but it's, as I mentioned, quite expensive for small businesses. And it's also an opportunity for government subsidy or shared lab partnership, for example, that could make a difference. This, I think, will help increasing access to a safer period product, especially to marginalized communities and rural areas. And I think beyond testing, the skills that are often missing are essentially for standard compliance, which is maybe universities and technical institution could play a great role here, offering maybe short courses or guidance to upskill MSMEs capacity. So it's not only scientific or technicalities, but it's also like organizational, I would say. And when you talk about the partnership with other countries, we also aim to be a regional brand in Southeast Asia and Australia. And we see a lot of potential partner with regional institutions that already have advanced research and testing ecosystem. For example, in Australia, we know university like University of Technology of Sydney or even UNSW and Monash University have strong programs in biomedical engineering, and that mostly work on menstrual health and women's health innovation. And also in Singapore, NTU doing a lot of research on this matter as well, which could leverage the Southeast Asian SMEs who may not have access to such facilities in their own countries. So I think that support could be also leveraged by partnership with organization like ASEAN Australia Center. That way, MSMEs in different countries can access those expertises and those information. So yeah, I think that's a great way to form like an international collaboration, so we can share best practices and then also give support where needed.
Thanks, Isha. I think looking at regional capacity building is an interesting lens. Selena, over to you.
Yeah, I think Risa mentioned almost all of it. And I agree. And I also want to say something a little controversial in some aspects, but I think we need to talk about it because finally, I am from the SME sector and we've been in kind of this space for almost 35 years. So for us, it's about livelihoods, right? But when you come to this kind of product and having only come into the menstrual hygiene space in the last 2 to 3 years, you start to realize that there could be threats to producing this product at a pure or you say a traditional SME level, right? So I think this has to be acknowledged because finally, consumer safety is paramount. And why it's even greater at this point, especially in the reusable space, is that if at this start we are really unable to create kind of safe products, okay, I have a visitor, Maya, okay, if we are unable to really kind of create safe products, have them adapted, have them really kind of brought into our community in a safe manner, it's going to create a threat for reusable products as a whole. So this becomes very, very important that we are able to have standardized, very good manufacturing happening, especially at the start. So this is why even at a Sri Lanka standards level, a GMP, a good manufacturing practice, was something that was insisted on by the stakeholders. And as SMEs in the room, it was very critical that we also supported this, right? So I think the discussion should be around SME production, GMPs, safety, and then in terms of that, we really need to start looking at what are the challenges. So, yes, production facilities could be a challenge. There are various things which then SMEs themselves should be able to kind of overcome, right? But one of the main things that I see that can really assist SMEs to kind of enter this space and provide that safe product is product innovation funding. Because finally, when I say product innovation, I don't mean creating product from, natural fibers, or I don't mean that level of femtech. What I mean is how can you take even the most basic product and make it safe? And this becomes critical for SMEs to become a safe manufacturer of these products. So this is an important discussion that needs to be had in the trade and SME space, which we are having in Sri Lanka at present. And maybe one more challenge that I should highlight here is that especially when it comes to the adoption of especially reusable products, safety in general is a question that is consistently asked, right? So we have to make sure that there is evidence-based, medically backed discussions and papers and evidence out there for SMEs to be really able to even enter this space. Because finally, why would an SME enter this space if they can't sell the product, essentially, right? So if there is no adaptability, then finally there will be no, at least from the SME space, there will be no organizations to access or use this standard. So it's a bit of a nuanced discussion, but I feel that we should consistently put safety and investment in creating safe products at the forefront of this discussion, as opposed to sometimes in our SME space where we talk more about livelihoods. Thank you.
That's very valid, Selena. I think only when an SME can, and this is my core belief, only when an enterprise can generate profit and do what it's supposed to do first, can it do the rest, which is generate livelihoods or create education and address stigma. So if the first doesn't work, then the rest doesn't work either. So agree with you on that completely. I think just as closing remarks, there is a clear sense of, I think, the fact that stakeholders need to come together. This will not happen in silos for sure, whether it's testing institutes, whether it's SMEs, and not even within countries. It has to go beyond. So any last remarks on from each of you, and very quickly, maybe like 30 seconds each, on how we can enable that as a community? Sivakumarji, why don't you go first?
Yeah, thanks, Tanya ma'am. And yeah, I think both Selina and Rucha, I mean, each have made a very good point. You know, it has to start from the manufacturers. This one, you know, the educating them, and even in India, we have the same scenario. We have a lot of MSME industries into this business, so we need to have a mechanism for hand-holding them and, you know, educating them and to help them in achieving GMP. You know, good manufacturing practices. There could also be some funding supports, of course, but there are other ways of supporting also. So I mean, in countries like, I mean, in India, we have the BAS listing out different laboratories which are able to do the testing, and they also give them guidance. We have a licensing system where the officer go to their place. I mean, it is not just you know, so inspection or something, but they also guide them in getting products in the right way. So that support is definitely needed, and so sometimes, you know, the standard will be initially voluntary, but once you make them, maybe if the national body makes them mandatory, then it will fall in place. But what is more important is the support to the SMEs per se. It is very much important, in my opinion. Yeah. Thank you.
And Dr. Zainab, over to you on how you think that can happen in Nigeria and beyond.
Okay, thank you, Tanya. Mr. Sajid Kumar has said most of what I've wanted to say, but I will add that there's need for technical support in a way by providing maybe a guideline on easy to understand documentation, like the checklists and the template for implementation of for effective implementation of the standard, and maybe by providing experts to guide the organization in applying the standard, and then also customizing of the generic standard to fit the reality of the particular industry. I think if we can do this, or also additionally, if a grant or incentive can be given to the manufacturer, to the SMEs, in a way, while certification training and courses, certification training and certification courses are being they're giving financial assistance on that. I think it will reduce the burden on them, and it will make adoption and implementation of the standard much more easier and smoother. Thank you.
Thank you. Very tangible, specific things that can be looked at. Thank you. Selina, over to you.
Again, I think to highlight from kind of a manufacturer perspective that it is vital that there's transparency to a large extent around how around transparency and technical knowledge, especially for manufacturers to really understand what's in the technical specifications behind the standard, right? Especially at a kind of a smaller manufacturer level, it's really impossible to find that technical support. So that does exist. But then at the same time, I think there is an absolute need on the side of the manufacturer to embrace the standards that are in place. So if they are higher than the standards your product is currently at, the answer is to then innovate and get your product to the level, because like I said, safety is paramount. So in that journey is where the resource constraints, the challenges and all of that would happen. So this is where I feel the standard making ecosystem cannot exist in isolation of the ecosystem that can actually create the product, that can distribute the product, that can adapt the standards in so that the women who are actually in need of this product can get it, right? So I think advocating for a less siloed approach, and thanking Tanya and everyone here and all the organizers for actually having this kind of webinar, because I think it's absolutely crucial to have these different perspectives spoken of. And to also, yeah, that's it. Nothing else to add. Thank you.
And each last remarks.
Yeah, I think all the awesome panelists already shared their thoughts, and I'm agreeing with all of what you're saying. But I think the most important thing is to continue the conversation, continue the, knowing what to expect and what to sort of like update in terms of what we can do as a small enterprise, doing what really want to do is to create a easier access for menstrual products, especially for marginalized and rural communities. So that's actually what the best way that we can do for now. So hopefully after this, we can continue the conversation. I'm sending my LinkedIn profile if any one of you want to connect, and then I'm happy to, share and learn from all of you. Thank you.
Thanks, Isha. Great. And we have maybe time for a couple of questions from the audience. So you can do that very quickly. One question, Dr. Zainab, for you. Reusable pads in Nigeria do not currently have a standard. What steps is Standards Organization of Nigeria taking, and how can SMEs engage with that who are making reusable pads?
Thank you, Tanya. Nigeria currently does not have a reusable standard on menstrual health, but we are proposing to adopt before the year runs out. There is a work in process. We have had meetings of recent discussing that, and the standard is we are adopting the African Organization for Standardization standard, which we want to domesticate in Nigeria as a national standard, and this will come very soon for the SMEs to use in the country, and the manufacturing of the reusable menstrual product, and then for them to participate in actually, we already have existing National Mirror Committee, but still, interesting SME can reach out to the national standard body, declaring interest to be part of it, and then we see what happens after he has sent in his letter declaring interest to be part of the National Technical Committee. Thank you.
Okay. And if there is an email or contact, you could put that in the chat box. That would be great. Because there are some stakeholders who are interested in connecting on this issue. And thank you. Thank you, Dr. Zainab. And last question, there were a few conversations around will the standard look at infections, etc. So in the interest of time, I'll just say that the ISO TC338 has a working group who's looking at general and safety requirements, which Shiva Kumarji is convening. And that is taking into account both bioburden, which is microbiological limits, as well as material safety requirements. So toxicological impacts of different materials that will be part of the product. So both will be included in that. And one last question for Shiva Kumarji. Testing agencies should be mandatory stakeholder in the development of standards. How can we enable and support their participation?
Yeah, and I mean, as far as the process goes, any stakeholder has to approach through their NSBs to become a member. And already there are a few testing agencies, testing laboratories in the group. In fact, I am also representing one of the laboratories, in India. So I'm representing CITRA, South India Textile Research Association, which has got a good laboratory setup for testing of these products as well. And there are a few more members, like one from Eurofins, and I think a few other testing laboratories are also there. But you know, you are free to invite a person to become a member. You can you know, ask your NSB to add those laboratories also as members to this group. Thank you.
And yes, and I think as Shivakumarji said, you can request your NSB include such stakeholders in the National Mirror Committee if they don't already exist, if they are not already part of the committee, and make those connections if you feel there are institutes who should be part of the effort. So thank you. So with this, we'll close our second panel. Thank you so much to all who were able to come and engage with us again. Isha, thank you to you, especially you, opposite to Cynthia. It's very late for you. So thank you for participating, and thank you to all of you for coming in. We have a last speaker now who will be sharing keynote closing address with us. And this is a very special person. And I'll quickly just share my screen. Very special person, Mr. J.K. Gupta, and I'll tell you why he's special is because I have personally seen him over the last almost 8 years, and taking up the agenda of menstrual product standardization in India. Sorry about that. And pushing for it, despite the pervasive stigma that exists around the issue at all levels. So I personally am very grateful to Mr. J.K. Gupta for this, but yeah, just quickly inviting you over. Mr. J.K. Gupta is the head of the textile department at the Bureau of Indian Standards, and he has over 25 years of experience and has led the development of 140 plus Indian standards across technical textiles, including agrotech, geotech, and medtech. And he's also represented India on key committees and presented 100 plus papers at national and international forums. Thank you, Mr. Gupta, for being with us today, and I'll hand over to you for your keynote address.
Thank you, Tanya. First of all, I actually congratulate you for such a lovely introduction. I have actually, I could take out time to hear all your panelists, and I could understand the sense of importance actually this subject is for the whole whole menstruating population at the world. And my personal compliment to you, because I know you have been taking care about this LMIC concerns, which is very vital for actually implementation of this, maybe either the national standards or maybe the rollout of this international standard. Going ahead, actually, the Tanya has requested me how we have implemented this Indian standards, especially in the Indian context, because India is a population of more than 1.4 billion people, and half of them around maybe 50 crores people, maybe, or 500 million people, maybe. Women may be mensurating on that. We have a committee called TXD 36, which is carrying out the national standardization in this important area of activity. I will be concentrating mainly on the support which we provide to the industry, especially the SMEs actually. And now I will start with their participation at the standard making process, because few of the panelists was also saying. So what we do, we support our SMEs actually. We ensure we fund them basically to participate in national and even at the international meetings. And we have made it a point to represent them also in those technical committees. So if you will see in this TXT 36 committee, it is having a representation from the micros and small and medium industries. And we ensure that their voices are heard. It is not like that, because the panelist was also saying they may have a little bit of a maybe hesitation to speak on those forums where the very high level of experts are speaking. So that became the role of the member secretary and the chairman. So we give them the equal chance. And in India, we work on the principle of consensus actually, where all the voices are heard, and we should not make a standard like that where all of the SMEs are out of the business actually. So that keeping definitely the safety aspect are the paramount. So in the standard making process, these are the things which, and we have a very robust standard. And in India, we have published more than 23,000 standards, and it's one of the top NSBs in the world on that ground. And regarding the implementation, also we have a robust infrastructure actually. And if I will say, this menstrual product standard, we have the reusable, we have the disposable, both the standards are available. And this has been very recently revised. Both of these standards, I am very happy. And I compliment the TXT 36 committee in this year 2025. And now it incorporates the requirement for panty liners, maternity pad, and the period panties also. So that is a great achievement, and now these are the latest up-to-date standards. And if I will see the regulatory framework in India, we have brought, because the it involved the safety and the health of the masses. So that is why we have made it mandatory. In India, nobody can actually sell, store, or distribute or manufacture these products without a license, which license basically give a assurance to all the stakeholders. Yes, these products are safe to use, basically. And we have already, and even some outside country want to export to India, they are also supposed to follow all these standards. And then again the questions come, ki how we support these SMEs. So there also, we have done a lot of work while implementing this type of a regulation. We give a staggering timeline, we give some extra time so that they can actually prepare themselves for understanding those standards, then implementing those standards. And because this licensing procedure involves some cost actually, and I am very happy to announce in India, even we actually give a concession in those things up to the level of 80%. So that is a very good incentive to the this women enterprises, or maybe for the small and medium and micro enterprises. So these are the important development. And regarding the test facilities, because it require a infrastructure and expertise. So what is the very important concept which you have done, that is called a cluster based approach actually. And that cluster based approach, what basically we do, maybe a set of the small manufacturer, they can have a common laboratory, and then it can be used by all those manufacturers to implement those standards. Apart from that, we have actually this created some sort of a product manuals. What you mean by the product manuals is, like we in a very simplified way, we inform them what are all the parameters the standard specify, and what are the testing equipment required, and then how you have to we help them to implement those requirements, and do a type of a hand holding. Dr. Shiv Kumar was saying we are doing a type of the manak manthans, because it is not possible for everyone to be on board in the committee. So in the clusters of the different regions in India, we on a weekly basis we do the manak manthans on different standards. Means that the SMEs and other people, they discuss there and put forward their collective comments to the technical committee to deliberate on that. And to give a sort of a R&D perspective in the standard developing process, we have a R&D funding. So maybe somebody want to develop something, somebody want to verify something on a application based things. We are at the BIS. We have a funding for the R&D. We actually give to the academic institute, to the committee members. Apart from that, now it is now there is a national menstrual health policy has also been implemented in India actually, and this is also a very important benchmark basically. And somebody was saying we have developed a standard for sanitary napkin vending machines, because you will find, because of the stigma they have in the smaller places, the people may not go and buy. So we have a vending machines where they can just actually put some 10 rupee coin and they are able to get the menstrual pads, etc. So we do a lot of hand holding. And from the point of view of the awareness, you all will be amazed. In India, we have gone up to the Gram Panchayat level. There are more than 2 lakh Gram Panchayat where we have created the awareness for the standards. We have created more than 10,000 standards club in the schools. So where we are educating students actually at the level of students, and all the districts, there are more than 750 districts in India. So we could even at the level of district level, we have educated all the government officials to procure. So that awareness part have been in last 4 5 years have been extensively covered. So these type of the hand holding at the time of standard making, at the time of the implementation, we are doing so that. And we have the Ministry of Textile has a scheme of that is called National Technical Textile Mission, which is worth 1,000 crores, where they support this SMEs also for carrying out any innovation work and some R&D, and that is also being funded. So if you will see, a strong infrastructure has been created in India, India being a very huge market for this product. And I am very sure with the efforts and of all of us, we are able to develop a good supply chain, and where up to the interiors of the places, we are able to see the availability and accessibility of this very, very important the product. And one last input which I would like to give, in India, there have been a good concept of this self-help groups. Actually, they are the self-help group where they come together, and a very low cost and good quality material they produce, and that is being also distributed to the people who is the last the poorest people. So I am very hopeful with this type of a initiative, we'll be able to take care of the safety and health of all the menstruating population. And but we definitely have to go in a long way. And this type of a seminar, I will request Taina ki that this should be a very regular exercise. And especially, and one last request to LMICs is that because at the development at the ISO TC 338, I find कि मतलब we should not complicate the requirement in the standard. So all the LMIC should come together, and with a collective voice, they should ensure that कि only the important requirement from the safety is to be only incorporated in the standard. So that will be my appeal to all of them, and they can take the help of Tanya, and we are also there for that, so that we can collectively take that work. And so that at the end of the day, a very stringent ISO standard come and you are not able to implement, so it will actually the whole purpose is lost then. So this is all I have to say. I once again thanks for such a lovely interaction. I've been hearing with all the stakeholders. The thoughts were really very useful for all of us. Thank you, Tanya. Over to you.
Thank you so much, sir. We really appreciate all the inputs, and I think some really great suggestions, tangible suggestions on how the ISO-TC standard can be adopted and rolled out in other countries as well. And I think there's also scope for BIS to see how it can support some of the other NSBs in the region as well. So like a regional leadership role in Southeast.
One small last input, Tanya. We have this SARC actually. There is an association of all the SARC countries actually, and this has been little bit revived now. So that so we are working on that. So definitely, it is a very good suggestion. We have taken a note of it. And one more thing, we are also carrying out one international training program where all the more than for 30 40 countries every year they come to our National Institute of Training from all the South African countries, and are more than 40 countries they come, and there is a 15 days all sponsored by us program, our Ministry of External Affairs, and I have been a faculty there. I actually taught a lot of this standard making processes there. These are the small two inputs.
Great. So if you can share the information, we can actually circulate that with the resources.
Sure.
Thank you so much. And with that insight, we come to a close for today's webinar. Thank you to all the speakers for participating, for joining us despite not very convenient time zones. We really appreciate your participation. We will share the recording and all the resources that were shared in the chat box by email to all who have registered for the webinar. So those will come into your email boxes. If you want to know more about the ISO TC 338, please reach out to the teams from the Swedish Institute of Standards. The emails have been put in the chat box as well, and the Ghana Standards Authority, who hold the Twin Secretariat. And also, please reach out to your national standards body for further engagement. You can also reach out to the team at MHAI for any further information. We are always there to help you. And we'll also be developing the advocacy toolkit that we mentioned by the first quarter of 2026 and hopefully made available for all of you. Thank you so much. And thanks to RHSC and SHF for making this possible.
Thank you. Thank you, everyone. Lovely
Thanks,
program.
everyone.
And the best part is that dot time. You started dot time and completed. Compliment to you, Tanya. Great.
Thank you.
We can have a small photograph if Tanya, you permit. You can request everyone to be can start their videos. You can click the photos for some social media post by you.
We've taken some, but we've definitely take snippets of that. Actually, it's World Standards Day next week, so we should.
14th, yes. I will be sending some invite to you also. We are also celebrating in a big way. Definitely.
So we will be putting together something for that, and we'll share that with you as well.
Okay. Bye, everyone.
Thank you, Tanya. Thank you. Thanks, everyone. Bye.
Thanks, everyone. Bye-bye.
Bye.
Bye.
बंद कर दूं कौन से है